ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Imua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Meghan Alonso.
And aloha, innovation warriors. It's Meghan Alonso, and you're listening to episode 75 of Inspired by Imua, where I talk with medical startups and industry experts that inspire every Tuesday. Wanting to innovate on an idea, but you don't know where to start? Well, it starts with your idea, but how do you know if that's even a good one? Take my quiz to find out over at imua-services.com/good idea. Imua is spelled I-M-U-A, and it's a Hawaiian word. It means to advance forward with passion despite rough waves. Again, that address is imua-services.com/good idea. Now, let's catch the wave of MedTech innovation with today's featured guest, Steve Ambrose. Steve, are you ready to hang 10?
Dr. Steve is here on the show, and he's ready to go surfing.
Woohoo! Dr. Steve Ambrose is a strategy and company growth leader with expertise in health, consumer, and patient growth, persuasive communication, product service development, and leading teams to execute. His purpose and passion are rooted in analyzing, engaging, growing, and leading expansion for hospitals and health systems. He is also the host of the Red Hot Healthcare podcast show, which you should also go subscribe right now so you can go listen later. So, Dr. Steve, give a little more depth into that intro.
I sure will. First of all, I want to thank you for having me on your show, Meghan. And I just love what you're doing and everything that you're about.
Well, thank you.
Think of what I do and what I'm all about as being a chief patient growth officer. That is that with everything going on today with the triple aim, and you may want to call it the quadruple aim if you want to throw in physician burnout and today's provider culture. Apart from all of that, there's a great opportunity right now in healthcare. Now, it's a big crisis to be sure, but moving forward, especially on the provider side, when we're talking about big health systems, hospital chains, and even provider offices, it is a tremendous opportunity for providers to start looking at growing competitively. Something that really healthcare has never done before is operate with competition like any other free market industry. And I know we're going to get into that today. That's what I do. I do it on a consulting basis now. I did it full time before in my last position for a rather successful company outside the healthcare space, but with millions of customers. And so that is what I do. Essentially, I am set on growing patient pools and helping to expand out the growth for hospitals, health systems, and other providers.
Mm-hmm. That's a lot going on there. And definitely with our healthcare system always changing. I feel like it's especially changing now. You want to be on the tip of that. And this goes for no matter how you're involved in that system, from a provider to a consumer, to a patient, to an insurance company, and also a MedTech startup company. We all need to be watching what's going on right now.
Yeah, I think that's a really good point. You know, the system we have right now has really been ingrained for 50 years, a little more than 50 years. I mean, it really started back when Medicare started. That's when this fee-for-service system happened. But the players, the MedTech companies, the providers, the insurance companies, the drug companies, for the most part, they've stayed ingrained and they've done business the way they've always have. And that's been great for them. Many of them are wildly profitable. They have been for decades. Healthcare right now, as you probably know, Meghan, number one employed sector in the entire United States. It just surpassed the federal government last year as the most employed. Yeah, it is. It's growing like wildfire. And I think that, you know, some of this is eventually going to come to a head. But for right now, healthcare is absolutely on fire. I just happen to think that moving forward, that the provider segment is going to have the biggest opportunity to grow, actually. I see payers, even though they're going to be around, I see health payers as eventually starting to pull back a bit, especially as innovation happens out there in terms of affording care.
hmm So, Dr. Steve, you are definitely an expert in all of this. What have you done recently to increase that expertise? We're always learning no matter what we're doing, but how have you been learning recently?
Yeah. I have a voracious appetite for learning, probably just like you, Megan. Most of the time when I'm doing my show, my podcast, what winds up happening is I do a lot of deep dive background research. So whether I'm interviewing somebody from a senior leader from Intel or from IBM Watson or from the Mayo Clinic or whoever the guest is going to be, I do a lot of deep research. And one of the things that I've always prided myself on is being a fast learner and a lateral thinker. I really like to connect the dots in unique ways. So I think the more that I've gotten into the podcast this year, which is something that on my show has kept me extremely busy, the more that I have learned many more concepts about healthcare and how to connect them in very interesting ways.
hmm Yeah, and there's a lot to be said for that, just connecting the dots. One of my other guests I was talking with recently, we got into the art and science, I guess, of social networks. And I don't necessarily mean social media, but just who we interact with in our lives. Like maybe you have kids, so you have that network of their extracurricular activities and their teachers and their school life, but you also have your business, you have a church, you have your extracurricular activities, and being able to look at those and then connect all the dots. And then on top of that, see how healthcare is impacting all of those areas as well.
Yeah, and the interesting thing is the more you do it, the more it becomes innate. The more you don't really have to think about structuring things, it starts to happen without you really having to pay attention to it. So, for an example, if you look at, let's say, value in healthcare. So I do consulting with different businesses in healthcare, some very, very small startups, actually. And everybody seems to be talking about value in healthcare. Well, you know, it seems to be that a lot of people assume that when you talk about value-based healthcare, you're talking about value from the perspective of, the business, keeping costs down. But it's also important to look at value from the perspective of the patient and not just in feeling like I'm getting something that is high quality, but is it even affordable? Is what I'm paying for affordable? Is it worth paying for? And that leads into a whole host of other things, such as pharmaceutical clients that I touch base with from time to time who have real issues with trying to figure out how are we going to be able to better engage our consumers, the people that are buying from us? Because a large percentage of people aren't even filling their initial prescriptions these days because of affordability. And I write articles about it, and that actually draws in new clients for me. So connecting those sorts of dots, a lot of times, particularly if you have a real passion for it, it winds up actually flowing through and then coming back in very unique ways and very valuable ways too, I should add.
hmm Interesting. So, out of everything you're seeing going on from your perspective, what's the one thing that medtech entrepreneurs or startups don't know that they should know?
Well, I would say that I'm gonna go off and say three. It's hard to stop me at one, and
We
it's
get
just
some
because
bonuses here.
yeah, I'd like to. Well, and please, I mean, my feeling is for those people listening here, I would advise you to do your own research and your homework. But I feel very strongly about these. And the first thing is especially when we talk about startups, I think it's really important to remove the confirmation bias. That's very important, I think. I'm a big believer in the Steve Blank model of
Mhm.
lean startup. I'm
Yes.
sure your listeners know that. If they don't, I would strongly suggest to learn what a minimal viable product is and a business canvas
Yep.
before you go out and write a 50-page business plan. I think it's important to get people to try to shoot down your idea. Try to actually tell you what you don't want to hear. And don't be afraid to share. Don't be afraid of competition. Someone's going to steal your idea or take your idea. I've got a very good friend of mine who used to work in senior leadership at McKinsey. And they don't even, when they talk about competition, it's like a 100-meter sprint. if you're the sprinter, you're looking at the end finish line. You're not running the sprint and then looking side to side to see what everybody else is doing in the middle of the race. And so many times I think that not just confirmation bias, but the fear that someone's not going to like my idea. Someone's going to take my idea. Someone's going to steal it if I get it out there and do an online survey. Someone will outgun me. That sort of thing, I think, has to go. The other thing I think, too, is to make sure you target and talk to your prospects appropriately. I mean, really to do your homework on every client that you want to reach individually. And do they really have a problem? Do you think they have a problem, or do you really know they have a problem? And do you really have in your product or service something that will really solve it? That's important. You need to have a heart-to-heart with yourself about that. And again, don't fall into confirmation bias. Well, we put a lot of money into this. We have a lot of experts design it. It's got a lot of features. Great. All that aside, does it really solve a pain point for who you're reaching out to? And I would say the final thing, Meghan, that I feel very strongly about is just make sure, especially when you get into an industry like MedTech, into a segment like MedTech, whatever facet of it you're in, it's getting so crowded these days. Lots of competition, lots of also-ands. Don't talk about features. Don't try to wow people with your features or decision makers with all your wonderful features. Really try to get to the core benefits. A lot of these people, a lot of these decision makers have so many vendors that they're lined up with that, frankly, if you come to them with something that's going to benefit them, that's going to really hit the right target, give them the right message, solve the right pain point, and you do it in a way that's genuine, not like you're talking at them, they're going to remember you. They're going to give your product a try. They're going to be much more likely to want to move you to the next stage if you're helping them first.
Mm-hmm. Yeah, all of that is fabulous information, and I agree 100% with all of it. And even so much, I was thinking, so back in your first point, try to get people to tell you what you don't want to hear. And you want to be shot down. You want to search for that, or you also you have to share. And I run into so many people that they don't want to share. They don't want to talk about their idea at all. And I say, you know what? Innovation doesn't happen in a vacuum. You cannot take this idea yourself and get it to market all the way yourself without talking to anyone about it. And it doesn't happen. And then with the targeting your prospects appropriately and with the benefits first features, I'm a big believer in that. And in my program, Invention Idea to Profitable Product, I go over what Apple has done. So let's see, we're doing this interview today, September 12th, when the new iPhone was announced today. So back in 2007, when iPhone came out, people would have thought they were crazy if you said, hey, do you want a phone that's 4 inches by 6 inches and has a touch screen and it's glass? And if you said that to someone, he's like, what are you talking about? I don't care. I don't need that. But if you said, hey, well, if you buy my phone, then you can have pretty much a computer in your pocket. You can take pictures, you can take videos, you can research the internet, you can get on social media with your friends. That's framing in a different way, and you're explaining the benefits of it. You're not explaining specifications and the features of it.
Yeah. And, a lot of it too is, and I absolutely agree with you on all your points here. But we have to remember also that even before the iPhone came out, there were other smartphones out there. And there were other smartphones that did messaging that were able to do a lot of what the iPhone did. The iPhone is something special. And for a lot of reasons, I think Steve Jobs, though he may not be my favorite human being in terms of the way he treated his employees, I think he really understood consumers. He really understood the consumer mindset. He did a lot of research. A lot of people think that Steve Jobs sort of was this bully who just kind of said, I know what's best. Steve Jobs did a lot of research. I had a guest on my show who runs a company that was actually with Steve Jobs at the beginning for Macintosh. He was on Steve Jobs' team. He's in healthcare now, and he's one of my guests on my show. But one of the things he said was a lot of people think that Steve was just, determined to get things done and he didn't want to listen to outside counsel. And he said nothing could be further from the truth. Steve Jobs was always taking in information like a sponge, he said. He would he'd make great decisions on them, but he was always getting information and he just knew how to critically think about the information and then apply that critical thinking to making quick decisions, and then failing quickly.
Yeah.
So yeah, I'm a very big believer in everything you just mentioned to your guest, and I think that if more companies did that, we would probably have less products on the market, but we would have better products on the market.
Mm-hmm. Yeah. So give an example of someone that you've seen recently that could have used your advice. And you don't have to name names here. Just tell us a story.
Sure. There was an individual that I talked to recently who's going to be on one of my upcoming shows. I will not mention this guest's name. I will only say that this guest held a very senior position in healthcare. And when this person comes on my show, we're going to address this point as well. But when the EMR portals first started coming out, the electronic health record, electronic medical record portals, one of the big issues was in the beginning how accessible it was going to be for companies, for, I should say, consumers, patients, to be able to access and download their medical records, and then how easily they could connect into the system to supply medical generated health data. So if, let's say, they were stepping on a digital scale at home or doing a blood pressure reading, that information could be automatically uploaded to their digital record and that, they could do that every single day. I think that there was a belief, especially from the federal government, from Medicare and Medicaid, as well as from these EHR manufacturers, that patients would just hop on board. And they would come in and they would literally say, yeah, I can't wait to download my records. I can't wait to communicate, look at my record on a regular basis and update it and send in all my data and information and submit all my, lifestyle updates. The fact of the matter is, it was originally planned for 35% adoption rate, that patients, 35% of them would engage in their medical records regularly. Turns out it was less than 2% when it was all said and done. Because what wound up happening was, and I told this individual on the phone the other day when I had this conversation, I said, it's not very surprising. You didn't understand the healthcare consumer. See, 3 years ago, 5 years ago, having connected healthcare data with patients wasn't important at all to hospitals and health systems. Having the ability for patients to download their records and make their records portable was really not of major interest to hospitals, health systems, and providers. It only became very important to them when all of a sudden now Medicaid and Medicare especially started saying, hey, we're going to tie some of your reimbursement into your ability to have this with your patients. And if you don't have it, you're going to get penalized. And I think it's a great idea to put it in there. But the understanding is once that happened, now it became important for hospitals and health systems and providers to start getting patients involved in supplying data and mobile health data and all that sort of thing. Now they got behind it, right? But it wasn't important 4 or 5 years ago when it still could have made a big difference in patient care. So that was the trigger. The trigger was money for the health systems and the hospitals, for the providers.
Yeah.
But the assumption was, once they fell in line and did that the patients were just going to fall in line. When you told the patients to do something, they would just do it. And patients surprised a lot of the companies that manufacture these electronic health records. We're talking about the Allscripts, the GE Healthcares, the Cerners, the Epics, all these companies that just assumed. And even Medicare, Centers for Medicare Services, just assumed that patients were going to get so excited about this. They didn't. Patients weren't excited about having portals. More and more, they're finding out that healthcare consumers and patients are thinking entirely different than we just assumed they were thinking. I would have recommended to not only Medicare and CMS in general, but also to these EHR manufacturers to do better marketing on the patient base and the consumer base. And if I could, just one other example I would say too is that pharmaceutical companies, I think, are historically very poor engagers to their paying customers. I think that they throw all these ads on TV. half the time they're talking about their their drugs causing serious disease and death, while some lady in the background is blowing, blowing a flower, and the wind is going and the sun's rising, and they're cleverly disguising all the side effects with your eyes being focused on the TV commercial. But at the end of the day, drug costs have gone through the roof. Drug costs have gone up so much in the last 6-7 years. It's quickly becoming the most unaffordable segment of healthcare for patients. And frankly, drug companies right now are more interested in getting patients on and selling through doctors, and they have to be focused more on consumers, especially since healthcare is becoming much more consumeristic than it has in the last 50 years. Consumers are shouldering far more responsibility financially. And guess what? Doctors, hospitals, and even drug companies who've been used to having payers pay for their services and products, a lot of them don't know how to deal with it. They don't know how to handle this. And that's where people like myself come in, people who understand the mindset of a consumer, how to target them and how to really get them to take action.
Mm-hmm. Yeah. I really feel like healthcare in general is just so far behind the curve in marketing. And then there's a lot of times these eggshells that you have to walk on. Oh, well, I don't know if that's okay to do for the patients, or there's ethics involved. And there is, I'm not saying you can't worry about those issues, but I feel like they just don't go there at all. And that's a shame. So on a brighter note, tell us a story where you've had a success lately, and maybe how you've helped a client or how you've seen someone succeed.
Yeah. Let's go back, rather than just the near-term clients that I work with now, I want to go back to maybe a bigger case of where this happened. And that was in my last position working for, actually, I was chief strategy officer for an organization that had, as I mentioned earlier, millions of online clients.
Mm-hmm.
And I was able to work with a team where we were able to actually grow revenue about 440% in one operating segment. And a lot of the step up there had to do with being able to redesign the the customer experience, which is online. Now, these are online loans. These are this is an area that I never had any experience with. I had been a healthcare provider for more than 22 years. And in my practice, all I knew was healthcare consumers. When you're a chiropractor, it's not like being an orthopedist or a neurologist where essentially you have family doctors feeding you patients through referrals. You got to go out and educate and get your own patients.
You got to be a businessman for sure.
You're right. You got to hustle. Yeah. And not only do you have to educate them, because chiropractic still in some areas has a bad name, especially areas that are not, a little slower to adapt to changes in healthcare. But the other thing is you have to establish value. You've got to meet the customer. You got to meet the consumer, I should say, at their need, and be able to actually meet that need with what you're going to be able to offer them. And then you got to be able to follow through on it. So when you're in practice, and I own my own clinic. Some days I saw over 60 patients a day myself. You're hustling and you're working and you're educating and you're lighting fires and you're changing lives. When I came to this company, I had decided to step out of healthcare and into the more of a competitive business segment to actually round out that side of my background. And when I stepped in there, I jumped in right away to a situation where we had millions of national customers, all of them fully employed, all of them, though, living paycheck to paycheck. This is what a lot of people don't know in America. It's sort of like the hidden truth. 7 out of 10 Americans right now, as we speak on this podcast, Meghan, have less than $1,000 of savings in their accounts. They may be fully employed, but they're living paycheck to paycheck. So all of a sudden, their car breaks down, their kid gets an emergency medical visit, and they've got a $2,000, $3,000 deductible. All of a sudden, they got to pay this bill or get their car out of the shop. They need something to float them. And that's an area that I had no idea existed. Turns out it's a $40 billion a year segment. And what wound up happening was we were able to grow. I was able to help lead a team to grow revenue by actually tapping into more of the emotional aspects of what a person goes through when they're under stress and why they might come to the site in general. and why they might be seeking a very short-term loan of $500 that they're going to pay back on their next paycheck in more than 90% of the cases. That is one of those things that the company I was working for designed a great product, had a great service. They were a market leader, but they were missing a few critical components in the patient experience. Just like in healthcare, a lot of providers, even drug companies and payers too, they don't understand the full gamut of the patient experience and the patient journey. They're starting to learn that now, and it's paying off big dividends. It paid off huge dividends. We made just a few changes on the front end field capture and on our back end marketing and email follow-up by plugging in specifics. It radically changed our ability to grow revenue. And not only that, to increase the satisfaction of our customers. If you could increase your revenue and at the same time putting a bigger smile on the faces of your customers because you're really meeting their pain points, you're doing something right.
Yeah.
And we did something right, and it made a big, big difference. And that is a lot of what I think healthcare needs today. And, and where I'm really looking to plug into that equation.
Yeah. And it's a lot of like in marketing, you create your ideal customer avatar and you design a story around them and you write down, okay, this is this person's name. Here's their life. Here's how old they are. Here's how many kids they have. This is the books that they read, the TV shows that they watch, where they work, what they do in their off time, and speaking to that and their language and their fears and their concerns. And that's exactly what you've done there is really hit the nail on the head. So that's amazing. I'm glad that you learned that lesson and then you're shifting it and, okay, how can we apply these lessons in the healthcare realm? So we're learning a lot of awesome stuff from Dr. Steve, and we're going to get his best advice after a break from our sponsors. What do Oprah, Bill Gates, Mark Zuckerberg, and hopefully you have in common? They all read or listen to over 30 books per year. I've got a way you can get there too. I listen to audible.com audiobooks, walking my dog Abby in the car, getting ready in the mornings, and I've got a free 30-day trial for Audible that you can claim over at imua-services.com/free book. Right now, I highly encourage you to check out The Lean Startup by Eric Reis. Are you tired of going to pitch competitions and not getting the investors' attention? Build your pitch the right way with a solid foundation. Invention Idea to Profitable Product walks you through building a startup around your idea to make you attractive to investors and gives you the perfect pitch in just 100 days. Try it out free at imua-services.com/IIPP. So, Dr. Steve, what's the best advice you can give MedTech entrepreneurs today?
I would say, and we go back before, two things. First, what we talked about before, solve real problems with real solutions that really hit on pain points for people that get them to want to say yes. Another thing too is, and this I learned as well, it's much better to get a fast no than to get a very drawn out maybe. You really want people to give you definitive answers when you're calling on them. It's important. Even when you're doing your initial product innovation, you're getting the feedback. Do you like this? Do you not like this? Oh, I'm not sure. Well, what if you were sure? You really want to get more definitive answers and clarity so that you'll be able to take the right steps. The other thing, and I want to stress this is especially strong, when you're in a very competitive space, you've got to start thinking outside the box. And I know that's a popular cliche, but I'll give you a great example. If you're a MedTech entrepreneur and you are putting intellectual property together, you want to put some patents in place, and all of a sudden you find out that you've infringed on another company. If you've built up market share, don't just assume it's a black or white game. Don't just assume it's either they're going to win or you're going to win. Maybe it's a great opportunity for a partnership. Mm-hmm. Maybe you can start doing an M&A and putting your forces together. There's a lot of partnerships and there's a lot of combined activities, channel sales relationships, things of that nature that started because there was initially conflict. look at conflict as a potential joining opportunity, especially in a really competitive space like when you're in medical technology.
Mhm.
It's crowded. It's going to get more crowded. At the end of the day, you've got to find what sets you off as different and then find ways that you can bond together if that's going to be able to leverage and make a win-win for both sides. More
Yeah.
important than ever.
I'm always a big fan of the statement of we don't have competitors, we have collaborators. And even though you have person A over here and person B over there, and they're offering the same solution, you're offering it in a different way. So why not capitalize on that? And that's a great example of that. So
Years,
what?
I want to just add one thing to that
Uh-huh.
if I could. Years ago, I was at we'll call it a motivational seminar. And we sat down in a classroom and we had a partner and we each had a desk, a shared desk. And we sat across from each other at the desk. And it was a rather small desk. And the speaker said, I want you to go ahead now with whoever your partner is. And I want in 60 seconds, I'm going to go ahead and blow the whistle. And in 60 seconds, I want you to actually lock your hands and I want you to arm wrestle. And in 60 seconds, whoever can pin the other person every time they get pinned, imagine I'm going to give you $1,000 for every single time you can pin the other person in 60 seconds. Ready? Go. And literally you could hear the grunting and the groaning and sometimes there were, big, strong guys against smaller guys or women, and they were just pinning them, that sort of thing. But anyway, after about 30 seconds, the speaker said, oh, hold on. He said, somebody come up to the front desk with me. And literally I was called on. I went to the front desk. I locked hands with this person. He said, let's go ahead. Ready? Go. And as soon as I went ahead and started to go, he let his hand drop. He said, now you. And then I went the other way and he let his hand drop. And we went back and forth about 100 times over 60 seconds. So we both won. And that is so important and exactly demonstrated that when people go into this sort of a challenge, they're not thinking, as you said so well, Meghan, they're not thinking collaboratively. They're thinking it's either I win or I lose or you win or you lose. It's all or nothing. And it just stuck with me even years later, that same exercise. And it just jumped into my mind when you talked about collaboratively. That was just something that came to me.
Yeah, that's a great story. So what's the best book you recommend and why?
Well, in keeping with my bonus answers, I'll go with two.
Okay.
So for the healthcare audience, there is a book that I can recommend over all others, and that is Catastrophic Care by David Goldhill. David is the CEO for the Game Show Network. He does not have a background in healthcare, yet it is probably one of the top 3 books I have ever read on healthcare. Very long story short, his father got ill, wound up running up $600,000 of bills in the hospital in less than a month. His father wound up dying due to medical error. And instead of Mr. Goldhill, who is very successful and well off himself, instead of him deciding to sue, he decided to internalize his struggle with the medical system and the whole healthcare system as a whole and find out, why did this happen?
Yeah.
He takes a very large step, the biggest step that I ever saw, and one that actually wound up changing my life and my path into looking at the healthcare system and why healthcare fails.
Mhm.
Why has healthcare failed? Why have costs gone up since 1950? The average sector in the U.S. Business market has gone up 8 times in cost. Healthcare has gone up 274 times what it was in 1950. Why have those costs been so hyperinflated? Why can't we solve for healthcare? Why can't it be affordable? Why did Obamacare fail? And he takes a big look at this system from an outsider's perspective. The book was actually forwarded by Malcolm Gladwell, and I can say Catastrophic Care is an absolutely winner book. I would recommend it wholeheartedly. And David was also my first guest on Red Hot Healthcare, just a shameless plug for my podcast, but he was my very first guest and got the podcast rolling, and I enjoyed our conversation as well. The second book is a book called Disrupt You by Jay Samit. Jay is a media innovator. He's a huge pioneer in music and video distribution. He's here in Los Angeles, where I live. And Jay's book is absolutely amazing. He's this guy really understands the dynamics of disruption, and he's got a tremendous grasp on innovation. I read lots of books on innovation and disruptive innovation. And this book, Disrupt You by Jay Samit, Samit, you can get it on Amazon. It is an absolute killer. It's a fantastic book.
Okay, we're linking to those in the show notes so you guys can check those out. And Dr. Steve, what's the best way to get in touch with you and your favorite quote?
Okay, so the very best way to get in touch with me first is to go to my website. My website, Red Hot Healthcare, all one word, redhothealthcare.com. That's going to take you in. You'll learn a lot more about me. And then we've got currently, in 2017, we've done 43 podcasts. So a lot of them are well followed, mostly senior leaders in healthcare technology. You can get that just by going to the site. My email is steve@redhothealthcare.com. I could always be reached there. And I'm an old school kind of guy. And I don't mean old school 1999. People say,
Yeah.
you ever notice that, Meghan, when people, I could just say unashamedly, I'm 49 years old. But when people say, back in the day, and they're talking about like 2009, and I'm thinking, oh, that's back in the day for you, huh? Well, when we go back in the day, it's even before my birth. I'm a very big fan of Dale Carnegie.
Oh, yeah, me too. Yeah.
I think the guy is just timeless and priceless, and he's amazing. So my favorite quote, which I think has everything to do with knowing your consumer and being able to target the consumer, is this one. And it goes, quote, "When dealing with people, remember, you're not dealing with creatures of logic, but creatures of emotion." And I love that quote. I love that quote every time I think about a conversation I'm going to have. That's going to be a sales conversation, a marketing conversation, a marketing strategy, a tactic, realizing what emotions are we tapping into. It's not that we're going to wow people because we're so smart. We've spent so much money on our medical product or our service. What do we need to tap into to get them to say yes, to tap into their emotion? So I love that quote. It's one that I've just ingrained in my being for years.
Yeah, it's so true. And speaking of books, I love the How to Win Friends and Influence People. That's a classic by him.
Yes, I love that one.
Yeah. Well, thank you so much for being on the show today. I learned a ton. I know you guys listening learned a ton. And if you want to check out our other episodes, hop on over to imua-services.com. And until the next episode, Imua.
Mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Imua is here to surf with you. Want to be a master of the waves? Text HANG10, that's HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyimua.com. Imua!